It doesn't arouse the same fears as breast or prostate cancer, but kidney disease kills more people each year than both of those cancers combined. Kidney disease is the 9th leading cause of death in the United States. And new research shows 6 out of 10 Americans will develop this potentially fatal disease in their lifetime.
Given a choice, 10-year-old Jose Gomez would probably prefer to be someplace besides a hospital room, but the choice really wasn't his to make. Jose's kidneys were damaged before he was born, and doctors knew he would eventually need a new kidney to replace his damaged organs. Jose's mother was prepared to give up one of her own kidneys and had already undergone tests for compatibility when she got word that another, even better match had been found.
It took me by surprise. I was not expecting it by any means. And to get that gift that matched so perfectly for my son, it was amazing.
The gift was a kidney that doctors described as 1 in a million. Jose underwent transplant surgery August 10th.
Well, I was kind of mixed with scared and excited, but I got over it.
And he remembers the first thing he did once he woke up with a new kidney.
Oh yeah, I chugged down like 5 cups of ice cream.
Dr. Puneet Sindwani is the director of the Oklahoma Transplant Center and the surgeon who performed Jose's transplant. A successful transplant relies on matching antigens, which are proteins on the cells of the body. Jose's mother had 3 matching antigens, but when the new kidney became available just hours before the scheduled surgery, they realized Jose was lucky.
He had a perfect match, meaning 6 out of 6. Yeah, I know that was unusual. So we got a call Friday night that we have a perfect match kidney for Jose.
Dr. Martin Turman is a kidney care specialist, a pediatric nephrologist at the OU Children's Hospital where the surgery was performed. He says this match was about as good as you can get.
It's not quite the same as an identical twin because there's a bunch of less important proteins that still are not matched perfectly. So he still does need some immunosuppression, but we'll be able to wean him off of prednisone quicker than we can other children.
Because the kidney Jose received is such a good match, doctors expect it to last for 50 or 60 years. Chronic kidney disease, or CKD, affects an estimated 26 million adults in the United States, and millions of others are at increased risk of developing the disease. Risk factors for CKD include diabetes, hypertension or high blood pressure, obesity, elevated cholesterol levels, and a family history of kidney disease. Lifestyle choices can increase the risk.
Number 1 cause of kidney failure in the United States is diabetes. And with the epidemic of diabetes related to obesity, type 2 diabetes, high cholesterol, so these can be something that if you take good care of these diseases, you can prevent kidney damage.
A simple blood or urine test can detect kidney disease while it's still in its early stages, but millions of patients are already at risk without being aware of the danger.
And it's not unusual that person presents to emergency room with not feeling well, short of breath, weight gain. It can be so many wide variety of symptoms, and usually by the time you start seeing these symptoms, it's very late.
Once kidneys fail, treatment options are limited. One form of treatment is dialysis, which involves being hooked up to a machine that does what the kidneys can no longer do, remove toxins from the bloodstream.
So your blood goes through the tubing into the filter, the bad stuff is filtered out, and through a tube the blood is circulated back. Typically takes 4 to 5 hours a day, depending on how much fluid they have to take off and how well your body can tolerate this shift in fluids.
Another option for those with advanced cases is a kidney transplant. Dr. Sindwani says transplants have clear advantages over dialysis.
Patients who get transplant, on an average, go on to live 8 to 10 years longer than patients who have not gotten transplant. So it prolongs your life. Number 2, it improves the quality of life because you're not hooked up to a machine 4 hours a day, 3 times a week. It's not a cure. Transplant is a treatment for kidney failure because you still have to take medicines, you still have to prevent rejection, you still have to watch out for your kidney function very closely, you might still have to see your physician very often initially and afterwards on a routine basis to make sure your kidney stays in good shape.
Not everyone who needs a transplant will get one. Dr. Kenneth Wojak is a transplant nephrologist. He says the number of patients needing a healthy kidney far outstrips the pool of available donors.
Well, nationally, there's approximately 98,000 individuals waiting for a kidney transplant throughout the country. And per year, there's around 18,000 recipients.
More than 600 Oklahomans are currently on a waiting list for a kidney transplant. The average waiting time is 3 years. Advancements in medicine over the past decade have increased the number of potential kidney donors.
For example, somebody is in their 60s and they have high blood pressure, but their kidneys are working well. We'll use these kidneys now, initially that were deemed non-transplantable, that has helped us to increase the donor pool.
Receiving a transplant can make a big difference in the patient's quality of life, as Jose and his mom can attest.
Now he can have all those foods that normal kids have. He doesn't have to really feel different anymore from other kids. And the medications are going to be fewer, so I think it's going to be definitely a big change for him.
Jose says he's looking forward to being able to do the things his friends do.
Like when they eat, they eat chocolate, so I can still eat chocolate now.
Jose has given his new kidney a name. In light of the high odds against finding a perfect match, he's calling this life-saving gift lucky.